What a beautiful, amazing Indian summer day here in high in the Rocky Mountain retreat where I'm at. We actually got a little bit of snow last night, so I got some snow on the motorcycle. I don't think I'm going to be riding today, but at least the sun's shining bright, and they're calling for 70-degree weather coming up. So I definitely am praying for a continuation of Indian summer till my birthday on December 8th, if I can.
December 8th. Well, we wish you a happy birthday.
Thank you.
Tim, you are a court-certified expert in medical marijuana. How did that come about?
What an amazing journey that was. It's nothing that you ever asked to become. Let me tell you that. But my doctor had asked me to get involved about 12 years ago now in patient advocacy. And by standing with patients who I was advocating for when they get in trouble with the law for marijuana possession, things of that nature, that was how I became a court certified. I'm actually certified in 11 different jurisdictions across the Rocky Mountain state and recognized by the Colorado Supreme Court. But basically, about 11 times it went, the prosecuting attorney, the defense attorney would suggest that I be certified as an expert in the area of cannabis and how it grows. And the prosecuting attorney would say, oh, no, he's nothing but a stoner. He has no specific credentials. So the judge would bang his gavel down. He did 11 different times and said, nope, he's a court expert. So for all intents and purposes, because I'm not a physician, I'm not a doctor or a lawyer, but I get to play one on TV and the radio type of thing and help educate where I can.
Tim, are you in court very often?
You know, it really is kind of like an ebb and flow situation. It seems like 3-4 years ago, we had a considerably more caseload of patients getting in trouble with the marijuana. But of late, the latest issues seem to be around this new found regulatory scheme that's called limiting the local city plant count to about 6 or 12 plants total. So, basically we've got an entity called the Colorado Municipal League, and they sent around suggested language for ordinances as if there was a problem with people growing cannabis, which really in the state for the most part there's not. But they wanted to have an overly burdensome regulatory scheme that limits it to 12 plants total and things like no outdoor growing and things that really are in direct conflict with our Colorado Constitutional Amendment 20 that gives our legal patients the ability to grow as much as is necessary, medically necessary. But also there's no inherent restrictions to things like having to grow indoors. And these are things, in fact, even in Longmont, Colorado, they've adjusted the potential ordinance language to include just ignoring the Fourth Amendment protections from illegal search and seizure and things like there's no need for a warrant if you know that there's marijuana in the home, that this ordinance language would supposedly allow the police to just gain entry without even obtaining a warrant.
Tim?
So
Tim?
I've been in court in the last couple of weeks, and I'm hoping to have this case that will change the whole entire case law in the state and throw out these ridiculous local laws that are being passed.
Tim, thanks. Can I interrupt and just ask you to please clarify for the benefit of listeners in other places of the world that Colorado, is where you live, is actually a legal state for both recreational and medicinal cannabis. Is that correct?
Yes, it is correct that if you're over 21 years of age, you can grow, own, or possess 6 plants, cannabis plants, as an adult. So that's a unique situation.
So since the legalization in Colorado, how has the public reacted, and do you have crazed drug addicts all around town? As some people would have us believe.
Yes, that seems to be the problem. Is as Dr. Bob Melamede, the guru of cannabinoids, as I like to call him, one of our partners with the Phoenix Tears Foundation, our science advisor, talks about the BIPs, the backwards-looking people, and the flips, the forward-looking people, and things like concepts of the third eye opening from use of cannabis kind of allude to a different type of an evolution of a person. And a lot of these prohibitionists that are out there are really using what little dastardly lies that they can get away with to really get some traction. And I'm actually actively involved in a advocacy for a ban. They want to put a ban on recreational marijuana in the town of Pueblo, Colorado, and they're coming up for a vote. But, these are like emergency room physicians, and some of the literature that's come out to justify the ban is claiming idiotic things like crime has increased by hundreds of percent, and just out and out lies. I mean, there hasn't been a problem in Colorado. Kids still get into their parents' pot just like they did back in the 60s. And for the most part, there have been no deaths reported. There are ancillary stories that kind of allude to that type of thing and crazed reactions from edibles. But for the most part, if a person overeats, even a younger person overeats an edible, they're just going to sleep. So it's about sleeping it off. And, there's so many ways that the prohibitionists really have been able to kind of make it an evil continuation of the reefer madness factor. Meanwhile, we have so many people coming to this state and having their cancer killed, having their child's epileptic seizures completely resolved, having their skin cancer dissipate. So many positives that we experience that, I'm very confident that when this year's election comes up, that for issues that involve different cities in Colorado associated with cannabis, that, some of the like in Pueblo, for example, they use negative campaigning. So the prohibitionists knew they'd have really a hard time getting a ban put in. But if you vote, the opposite of yes to no in the voting booth, that they figure that maybe the voters aren't going to realize what they're actually voting for, and so that they're going to accomplish their goal by backwardsly really getting people not understanding the issue and voting in their direction toward the ban. It's real thin-veiled attempts,
Tim, I believe there are 9 states in the United States who will be voting November 8th on legalization of medical marijuana and or recreational marijuana, depending on the state. Is there much evidence of the pharmaceutical industries or the alcohol industries lobbying to oppose the legalization of marijuana or medical marijuana?
Yeah, it's interesting that you bring that up. It seems like as each year passes for the last 10 or so years, it seems like more and more we're hearing of private entities that are associated with larger corporations and, the tobacco industry lobby, the alcohol lobby, Now the latest is the fentanyl patch manufacturer. They realize that cannabis is having an amazing effect on the legal states in people using less prescription medications, including things like fentanyl patches that are used for pain, because they can use a very benign substance that's totally natural as opposed to a very, very strong fentanyl patch, which people are brought into the emergency rooms with overdoses of fentanyl patches regularly, and there are deaths even that occur from that. But they've spent supposedly behind the scenes millions of dollars towards against legalization efforts. And it really, I just have to mention that the word legalization is such a perversion for what is being really suggested. As my counterpart, Robert Chase, with caregivers and patients here in Colorado, has said many times that, here in Colorado, we've actually got more laws that are against marijuana that are on the books now than there were before we had quote-unquote legalization. And California's the AUMA situation out there really calls for, if a person gets caught with more than an ounce of marijuana, it's almost like a death sentence. And I'm sure for the atmosphere that we've had out in that state since 1996, when medical cannabis was legalized there, it would have a very horrendous effect, and it would find a lot of people who weren't previously eligible for conviction really right there in the face of possible prosecution. And so we're voting, we're suggesting that folks really kind of wait until we have more of a reasonable language that's not over-regulatory in nature on these states that are trying to legalize. They need to really look hard and fast at states like Colorado and Washington, where basically they've almost wiped out the entire medical marijuana program, and the Liquor Control Board runs it, and they were proved originally to have emails where they were selling licenses for dispensary stores to individuals before the licenses were even to be available. So,
it's a similar situation. It's a similar situation that is occurring in this country, in Canada, where some people suggest that medical marijuana should be sold in liquor stores. Some suggest it should be sold in pharmacies. But Tim, you made a brief reference to it a few moments ago when you talked about people moving to Colorado. Tell me some stories about people that you've talked to who have moved to Colorado who have had some serious health issues, or their loved ones have had some serious health issues. They couldn't get relief in the state that they were living in, so they moved to Colorado, went on medical cannabis, and their lives, or the lives of their young loved ones, have changed.
Oh, near and dear to my heart, I would have to mention Dahlia. Little Dahlia, the brain cancer patient, her mother, Mo Barnhart, out in Tampa, Florida, is probably most famously known as one of the original Canna moms. And, to have that little girl come and be able to come to Colorado from Florida, she'd already been to multiple states, hospitals, and, 3 brain surgeries. The second one, the brain had kind of necessitated surgery for a third surgery to occur, and for her to be able to get a quality of life back and really begin that journey of healing. Of course, they went back to Florida, and Mo is very active as an activist to try and change the policies out there, and was a big part for approving the CBD, the legislature, the CBD dispensaries that they already have. But this poor little girl, wasn't deserving of the level of problems in her life in her first 3 or 4 years, and it really during going through things like chemo and what have you, to be able to embrace natural therapy really helped her to not have the nausea and really give her a quality of life where right now she's somewhat like a normal little girl. But I have to say, recently she got some rash from an immune system. I believe she caught shingles, and that's a condition that I had caught at one point. It took me 18 months to overcome that health circumstance. But, the changes in lives, we have people who are stuck in Georgia right now with GoFundMe accounts that really would like to make the transition but need enough money. The people that are on other Indiegogo fundraisers that basically are looking for $100,000 for some CBD therapy, which technically right now is kind of like, wow, where do they need $100,000 from? When technically speaking, to come out to Colorado from another state and embrace the therapy, it may take a few $1,000s, but nowhere near that. And we're just so amazingly blessed with the Rocky Mountain State being one of those places where everybody gravitates towards. This is a place to come to for our quality of life, and people are really friendly and engaging. So for the most part, folks are able, when they do come to the state, are able to connect with some locals or some people that are in their similar situation, most oftentimes on social networking. And these relationships evolve over time, and folks come up from Texas. I know of a young lady with breast cancer that had come up, and she was able to use both the oral oil and a lotion medication, and she was eligible for a radical mastectomy according to traditional doctors. But with a sabbatical here in Colorado of a matter of a few months, she was able to change her life. But most people can't just break away like that and get to do the treatment in another state and pick up with jobs and all those types of things. And I'm just really excited now that we're reaching a new evolution of the hemp industry and the breeding capacity and changes that have allowed the hemp plant to have a higher cannabinoid profile of healing components that apparently kill cancer quite effectively. Things like THCV and CBG and other cannabinoids that are available in a hemp plant, which Colorado is a legal hemp state for growing. Hemp was part of the Farm Bill in the U.S., so we have quite a number of states growing the hemp. But really the CBD oil that has been brought over from Europe, that has been processed correctly and is an effective therapy on some levels, is like apples and oranges compared to the full profile of cannabinoids available in some of these cultivars of hemp strains that are distillated under conditions which allow for most of those cannabinoids to be available. And so we've gone from a philosophy and a protocol of 60 grams of cannabis oil taken in 90 days to a situation where we can have a tincture bottle of 10,000 milligram CBD that is actually taken over a 2-week time period, and then we recommend you go to the doctor to see if your cancer's been killed.
How much CBD was that again, Tim?
Yeah, it's a tincture bottle.
Yeah.
A normal sized tincture bottle.
Yeah.
And the thing of it is, it's about $1,800 for the cannabis oil, to purchase a 60-gram regime of protocol. Nowadays, we can get a 10,000 milligram bottle of tincture for about probably $600, $700.
So what's the cannabinoid profile out of that one then? Is it just CBD, or is there some THC in it, or?
No, it has very little THC, but it has the enhanced cannabinoid profile with it's been bred to have really high levels of additional cannabinoids like the THCV and CVG.
Okay.
CBG. This is stuff that we're boots on the ground. This is in the field kind of efforts that we're making right now. And it's really changing the whole course of first off, hemp is completely legal, so that brings things into totally different ramifications, and maybe the person doesn't have to actually leave their home and their state in order to embrace the therapy. Just lately, yesterday, I was at a diner, and the waitress, believe it or not, I was introduced to as an epileptic patient. And she's been taking CBD oil, but it hasn't really been very effective for her. And one of the things she mentioned was, oh my gosh, the taste is so unbearable to taste the hemp oil. And I'm like, well, I'll bring you down to a friend of mine, Todd Young, in Arvada, has a greenhouse operation, and they called Raven's Medicinals, and he's doing some advanced healing work using oils with higher cannabinoid profiles, but also he's using things like macadamia nut oil and having cherry flavoring added. So
nice.
It really is important from a patient standpoint. The old days of Mary Poppins and having the medicine be palatable really are very important therapies for our patients to be able to embrace it without having issues associated with nausea and things of that nature.
Yeah, it strikes me as someone who's new to this, understanding this industry, because when I was in commercial radio and interviewed Corrie once a month, the very first time, Corrie, I interviewed you, you must have thought this guy's an idiot. He doesn't know anything about anything about marijuana.
You hit it well.
Yeah, I hit it well. But it sounds to me, Tim, like we're really in the infancy of this industry in determining what is beneficial for specific ailments. Do I have that right?
Yes, I think you're hitting the nail on the head. I mean, what works for some maladies doesn't work for others. I'm sad to say across the board, cannabis or hemp isn't the answer. But in terms of really adjusting people's quality of life to the positive and allowing them to embrace a philosophy of not using prescription medications. I mean, most of the time when I run across new patients, they're taking upwards of 10 and 15 different medications a day. I mean, 7 pills in the morning and 8 pills at night. And, I just had my doctor, Elke Glazer, I had found out about recent consult that she did with a young man who's autistic. And there really is no need for these prescription drugs. In fact, this young man had been taking for years Effexor, which basically the poor young man has a heart pacemaker now at the young age of his early 20s. And we have a solid belief at this point in time that the Effexor is the reason why he got the heart problems to begin with. Mm-hmm. And they continue on this path with the Effexor. And when this young man was recently in an emergency room situation, here we are in a legal state, and it wasn't the doctor in the emergency room, but it was the nurse who, when he made mention of the fact that for his muscle spasms and that, for the most part, he's a legal patient and uses a lotion, a cannabis lotion. Well, lo and behold, here comes a complaint to the social worker, human services. A case is open. The next thing you know, the police department comes, and the mother was kind of slowly coddled over to speak with other medical professionals while they could hurriedly bring the police in to interview this young man who was a legal patient to begin with. And then, of course, that turned into a couple days later a visit from law enforcement to the household to find out how welfare check. We're still in a atmosphere in the medical department, in the government, that really, when some of these medical professionals at the hospital, when Dr. Sanjay Gupta's name was mentioned, these medical professionals had no idea who he was. I mean, I think there's a clear need for education, and there's going to be for some time to come a need for advocacy, and for people like myself that are willing to kind of stand up and get in the way of a process gone wrong.
Yes, Sanjay Gupta is a medical doctor who is on CNN. And he, at one time, was opposed to cannabis. Then he went did he go to Colorado or California? Did some research, and now is a proponent of its use. Colorado. He said 19 people a day die of prescription drugs in the United States, and there has been no recorded death, I think, ever of anyone who's taken marijuana / cannabis.
Definitely. And I mean, we have to mention our veterans. Our PTSS, they call it post-traumatic stress syndrome now, but we have upwards, I understand, of 22 veterans a day committing suicide in the United States, and it's a horrendous figure. And the fact that the VA will not embrace and allow the doctors to have these veterans get the therapy that they need is really a national tragedy. It truly is.
Tim, I think we need to mention to maybe listeners who don't realize that PTSD or PTSS patients do very, very well with cannabis. Extremely well.
And I have to tell you that we're kind of developing a protocol of about a 7-week intensive CBD oral therapy situation. I'd like to do it in a remote location where the patient can actually learn a little bit about nutrition and yoga, and do some horseback riding, horsemanship training during a 7-week period while they're doing the oral CBD therapy. And it really goes a long way for helping to allow for new brain mapping and bridges to be connected that allow these patients to have some tools where when they leave of therapy regimes such as I'm suggesting, that they really have things things to work with beyond where they're at right now. And I really have to make mention, I'm in the process with Phoenix Tears Foundation. We're developing some strategic partnerships, and we're in the process of possibly setting up a Veterans Village circumstance in Pueblo, Colorado, in Alamosa, Colorado, and also in Orange Cove, California. So we're maintaining strategic partnerships with businesses like Ponic Pod that makes a grow building for anyone that's involved in growing hemp or cannabis and needs the security and safety and sterility that they provide those units. I'm also partners in a new nutrient company that was some nutrient that was developed by NASA in Cape Canaveral for the Mars Veggie program, which to be able to grow plants on Mars. So this company is called Space AG, for space agriculture, and we do one plant at a time, one planet at a time, if it were. It's the most studied fertilizer in the world. NASA has been studying it since 2008, and it was developed. It's a chelated mineral that has a polymer coating on it that can be dialed in for exactly when that plant needs to be getting that boost of nutrient. And so it could be 80, 100, 120 days. But the cool part about it is it uses a third, it allows the plant to use a third as much water. It grows a third more bud sets, and it grows a third faster. So they tested it on the International Space Station, and the tomatoes were growing at like 36 days instead of 57. And the astronaut who just came down from the space station had eaten all of the tomatoes and what have you. So it really is, it's, as I say, one step better than organic where we're going with this, because the plant doesn't need to prepare the mineral for uptake. So we got that sponsorship on the business side. And then we've got I'm involved with Colorado State University at Pueblo. The state legislature got them $900,000, and they've set up the Institute for Cannabis Studies. And I've been invited to be an adjunct professor at the university in the fall of 2017 coming up here. But it's so amazing that we can provide from industry and work with the nonprofit like Phoenix Tears to bring about this collaboration where we have the land, and the professors like Dr. Kelly Holhoff can do vertical grow technology research. Dr. Jane can be involved in engineering and things at a facility where we're going to have Veterans Village outreach activities taking place. And, you know, our site in Alamosa is to be all sustainable. And we're working with a group that has it's the Reef Farm. It's a energy efficient farm that basically, when we're talking about the land, it shows respect for the land and earth and water resources, but it provides for a community. And so with that in mind, we've got a project down in Alamosa that has geothermal. It's 128-degree water coming out of the ground, and we're hoping to develop this Ren-Gen village, which is actually houses that are inside of greenhouses. And this 140-acre development there, it's been done in Netherlands, the country in Netherlands, and it recently won the United Nations Sustainability Award. So, you know, we're involved in so much with regards to saving, healing, and feeding the planet.
Great.
That's kind of what we're involved in. And my mentor, Dr. Albert Sanchez, he's the father of poly-MVA, has a cancer center named after him in Oklahoma. And his organization that we're partnered with, Saving, Feeding, and Healing the Planet, I think really says it all of what we're about. Trying to do our part to fill the gap where our government has not been able to help.
Tim, it's great stuff. It was a pleasure to talk to you. Next time we'll refer to you as Professor Tipton.
Well, I'll always be the Colorado Midnight Rider. So
okay.
When you see the comic book, when it comes out in December, we're going to be having a Patient Cup event December 11th. I'm hoping to have the new Colorado Midnight Rider comic book out. And without a doubt, it's going to be an educational and a parody on some of the fallacies brought forward with these prohibitionists. So I'll make sure that we send you out some copies to the station, and Corrie can have an autographed copy too.
Perfect.
Well, thank you, Tim.
Thanks, Tim. Pleasure to talk to you.
Sure. Hey, have a great day.
You too.
Thanks, Tim.
Bye-bye. That's Tim Tipton in Colorado. Interesting guy.
Very
interesting
He's got his hands into everything. He's very interesting.
Doing a lot of good work. How did you meet up with him?
Tim is connected with the Phoenix Tears Foundation, as he mentioned, and I'm patient advocate with Phoenix Tears.
Mm-hmm. Good. I should remind our listeners that if you'd like to make a donation to Cannabis Health Radio, after all, we are listener-supported radio, go on our website, cannabishealthradio.com, and go to the donation page and make a donation. No donation is too small. No donation is too large. And we very much appreciate it because we want to spread the word around the world about the use of medical cannabis and help as many people as we can. Corrie, let's do this again tomorrow.
Sounds great, Ian.
Thanks very much for listening, everyone.
You've been listening to the Cannabis Health Radio podcast. Visit our website, cannabishealthradio.com, and follow us on Facebook and Twitter.